Good morning, everyone. It's Friday morning, almost 9 a.m. Thank you for joining. For you early joiners, really appreciate it. Shondell and I have been on practicing, making sure everything is working. So Jeff is on the road today. So he may pop in, but we heard a lot of road noise. So he is going to
Yeah,
stay on mute. There he is. I can hear him.
except for now. Yeah, no.
Yeah,
Just
I think
driving the
he's
highways and byways of Ohio.
there. You
Beautiful,
go.
beautiful
Yeah.
morning.
We still have more people joining, but I want to. It's Friday. You all have a lot to do ahead of enrollment season, so I'm just going to get started, and those people can catch up when they join. So, Shondell, let me go back, make you the presenter, so you can share your screen
Yep.
and get rolling.
All
So we're
right,
really
perfect.
excited, gang. While Shondell's bringing that up, this is part two. When Shondell was on last or 2 weeks ago, we didn't have or he didn't have the full plan details, but he does now. We kind of did a review last week, so some of the intro slides and um, some of the ending slides you may have seen, but you will see the benefits information coming up in about 10-15 minutes. So if you joined the call earlier a couple weeks ago, thank you for doing that. And thanks for coming back on. Some of you, it may be your first time. So, um, Shondell, go ahead
Mhm.
and kick it off. I'm going to go off camera so I can pay attention if there's any questions. And gang,
Yeah.
I will, I don't want to interrupt Shondell a whole lot because it kind of drags things on, but I will answer your questions at least by the end, or if it's something really, really glaring, I will stop them and we'll get him. We'll get that question answered right while he's on it. So the question,
Awesome.
just look at the question box, and you will be able to put in your question there. So take it away, Shondell. Thanks very
Yeah.
much.
Awesome. Yeah, yes. Make stop me too if anything, and
Okay, very
also
good.
with the slack
All
stuff.
right,
So,
very good.
yeah.
Take it away.
Grand rising, everyone. Hey, it's a Friday, right? It's Friday. I'm here to bring some energy to you all and bring some great stuff about Ambetter. So you can leave off on a good note to your weekend. So this is part two. I got some great information to share with you. So we're here in Ohio. I'm gonna go ahead and get started. Um, so yeah, some of this information here, I'm just going back a little refresher. The reach of Ambetter. We consider ourselves being the number one marketplace carrier. I will say that we are the Fortune 22 as well. I've been with Ambetter going back since 2017, so I've been with them for about 7 years, and it's amazing to see the growth that we've gained over time. And that's 4.3 million members. 29 states, and been in the market since the beginning. So, and then I want to note too on something. I think it's on the next slide actually. Just to let you all know, Iowa is a new state for us that we're entering for 2025. So if you are licensed there, you got some business there, or looking to sell there, make sure that you get appointed. No problem. Also, keep in mind that Ambetter has exited out of New Mexico. That was effective December 31st of this year. So we won't be there. I do want to let you all know about it's a state. So you'll see on the map, California is highlighted. I know there could be a little bit of confusion at hey, does Ambetter have individual plans there? So I will say this. California is a different entity through Ambetter. It is called HealthNet. It is only for California-based residents. So if it's something where you want to get contracted or sell plans there, you the agency will have to reach out to HealthNet alone, not Ambetter, but HealthNet. You can look that online and all that's all up on there if you need to look up information around HealthNet. But just keep in mind that California is through a different entity through Ambetter called HealthNet. So it's just California. You like I said, it's not any what I like to call it crossing state lines either. You won't be able to do that. So just keep in mind this is only California. So And better health updates. So just a few updates for you all. As you've seen, Gold, Silver, Bronze Network, which was called Core, will now be called the Premier Network. Okay, starting the open enrollment. Members have access to the Ambetter Health app that launched back in July. Your broker portal was enhanced quite a bit, so you'll be able to see renewal letters up in there doing OE, as well as having the option to set up auto pay for all of our states. We're expanding into Iowa, and we have created a diabetic condition specific plan just for those that with diabetes, which will be available in these following states: Florida, Georgia, North Carolina, New Jersey, and Tennessee. I mentioned plans no longer offer in New Mexico, and Ambetter virtual access plans will or have been discontinued. All right, renewal letters. So September, renewal letters were sent notifying those members if their plans has been discontinued. October, renewal letters were sent for members with plans that will continue. And then November, those renewal letters will be accessed in your broker portal for you to have access. So continuing on the renewal letters, I know September for discontinuing plans, October for continuing plans. It's just a sample of how those renewal letters look. In case the member came to you. So any you all know this, right? So no changes or anything like that. They'll just roll over, etc. But just to keep you all mad about the renewal letters, just how they look. So auto renewals, refer to as past renewals. You know this. So any changes, as I said, no income changes. They're just going to roll over to the same plan. If there are discontinued plans at all in any of our states, we send those letters out. We put them on a similar plan closest to the other plan that they was on. Renewal letters will mail out by October 31st. That's when they mailed out. Binary payment reminders. So we sent out, we took quite some action into ensuring that members make their payments. So we're doing emails, texts, outbound calls, to send these notification and reminders for members. So we know that you brokers reach out, but we're also reaching out too. So we want to make sure everybody get paid. That's how you get paid for commissions. Payment outreach. So existing members, those that are 30, 60, 90 days late, we send those out as reminders. This is also, you have access to look in your portal as well. Information package. So what comes in the information package? Remember, those newer reminder members making their binder payment, just keep in mind though that once you make a payment, it takes approximately 7 days of receipt of payment, so they can get their welcome package. So they have to make that payment first in order to get that. I know some members be like, hey, I haven't got it. Well, you have to make your payment first. Make sure you do that. Okay. So you get some of this information, welcome ID cards, etc., in that work that you'll get in the packet. So what's new for 2025? As I mentioned, we are going to Premier Network on the meta tiers. Okay. The app launched back in July. I mentioned the renewal letters. Ohio is expanding to Hocking and Morgan counties for 2025. And our new off exchange plans for 2025, which is called Ambetter Health Solutions. So let's dive a deep into it. So in the last meeting, there was about 8, 9 counties that I mentioned that we're going to be entering. Those were only prospective counties that we was trying to get into that I was told. So we were only able to get into 2 counties. So finalized, confirmed that we'll only be entering 2 counties in Ohio, Hocking and Morgan. Just some network highlights, top reason to sell. You can find it actually in your broker portal too. For yourself. This is not all of our networks. This is just partial provider list that we just want to pinpoint on certain areas for you. So there have been much changes, with the network, try to be consistent going to 2025. Going to the bonus. So this is the new member bonus. All right, this is actually just a sample of the bonus that we did last OEP. I was told that there shouldn't be much changes at all. Wouldn't be much changes to the bonus. I think Michigan. I think there might be a little tweak in one of the states or two in this, but this is just an idea to let you all know this. This is an outline of how the bonus looks. So start thinking about this. If I was to get this amount of membership in this state in this specific tier, I can get. I can make this much. So you have one effective date and 2 1 effective dates. Portfolio highlights. So used to be called Core, now called Premier Network. This is the same thing that you get with Core. You know, you cross state lines. I think that's the biggest seller that you can let members know about. Any network provider crossing state lines, the provider guide, you get the same benefits, same results, and then our adult vision and dental buy-ups on many of our plans. All right, product offerings. We are here on the plans. We are here on the plan. So I want to let you all know that I will follow with the agency about putting together some plans per some states, and that way they can share with you all. But Ohio, talk about Ohio specifically, it's a premier, broken down to three tier. We have our bronze, silver, and gold. Bronze has the choice bronze HSA, the everyday bronze, the standard expanded bronze. For silver, we have the clear silver, complete, and the standard silver. And then for gold, we have the clear, complete, and standard gold. All right, starting with the first plan. So we have our Choice Bronze HSA plan. Okay, I'm not going to cover every single pocket on here, but you see it. This is a HSA eligible bronze plan. It has a matching deductible and a maximum out of pocket. There is no charges after deductible is met, as you can see. So that would tell you that the member do have to hit their deductible before that kicks in. Keep that in mind. All right, the clear silver. This clear silver plan has a matching deductible and a maximum out of pocket. Does have a $0 prescription after the deductible is met. Does not include vision and dental. Keep that in mind. This plan specifically started at a base at $6,500. It goes as low as $800 under the 94% AV. We have zero co-insurance across the board. Virtual 24/7 care. There's no charge across the board. And then you can see some of the RX drugs and preferred RX is 0% after the deductible is met. All right, this is the complete silver plan. This plan has a $0 deductible at the 87% and 94% AV. It does include a $0 PCP visit with zero lab and generic prescriptions. Paying attention to the AV level, right? So this started at a base at 6,000 deductible, goes as low as $0 under the 94% AV, goes as low as $1,700. There is no charge for virtual 24/7 care on this plan.
Hey, Shondell, I lost your audio for a second. Please check
Okay.
on that.
Uh,
Um,
I'm good now.
yeah, you're good now. Go back one last slide. I think maybe the last thing I heard was the 94% actual value. So I don't think anybody heard anything after that.
Oh, okay, yeah. So after that, I mentioned saying that there was no charge for our virtual 24/7 care on this plan. Okay, and then you see some of our RX started at $3, like the preferred generic, going as low as $0. So depending on the member income level where they fall, you can see which may be the best plan for them. But yeah, this is the complete silver plan.
Great.
Okay, I'm going into the next. Okay. So this is a silver comparison. This is actually at the 94% actuary value. So we're just comparing this clear silver and the complete silver plan, right? So you have the clear silver, which is an $800 deductible, and then you have the complete silver, which is a $0. And as you see, the max out of pocket on the clear silver is $800, complete silver 1,700. No charge for virtual 24/7 care on either of these plans. You have lab. Uh, it's $5 for clear silver, $0 for complete silver. There's $0 for preferred and generic. I know for the clear silver, it does say 0% after deductible. So again, keep in mind the member does have to hit the deductible first before that kicks in. So I just want to give you a couple ideas what this looks like. The $0 deductible, zero PCP visit, zero lab, generic. So it's a good plan. Standard. So we have the standard silver. So this specific plan does have a $0 deductible. $0 PCP visit at the 94% actuary value. Start at a base at 5,000 for the deductible and goes as low as $0. The max out of pocket goes as low as 2,000. We have our PCP visits, $40, one as low as $0. Then for the preferred generic, it does start at $20, goes as low as $0 on the 94%. Then urgent care, $60 going down to 5 respectfully on the standard silver plan. All right, Clear Gold. We're on a Clear Gold plan. This has a lower cost premium. It does feature the co-pays for generic prescriptions and urgent care. It has a $900 deductible, $8,400 max out of pocket, 30% co-insurance. They have lab, 30% after deductible is met. We have the copay for preferred generic, $3 and $15. And then urgent care, $60, $0 copay. Virtual. Love virtual. Teledoc. So, Ambetter, all members do have access to our virtual services through Teledoc Health, which is a 24/7 help for non-emergency issues. Okay, understand with Teledoc, regardless of your physical location, easy and fast, rural areas. So, all our plans, we do have this as there for the member. Great benefit. Adult vision. So, this is an outline of how our vision looks. I do want to let everybody know that the network, in case you get a question or want to know, hey, what's your network? It's called Centene. It used to be called Involve for both our vision and dental, but it's going to be called Centene, Centene. With the adult vision, this is a 19 years of age and older, no waiting period, does have to be in network. You can see there's a $0 copay for the exams and eyewear, covering it up to $130. You have your eyeglass lenses covering up to 100%, and then the contact lenses. So those lenses covering up to $130, and then you have your specialty lenses fitting up to $50. Then going to the dental. So dental is also no waiting period, 19 years of age of older, has to be in network. You can see for the class one, there's a $0 copay. And then you have the class two going into some of the minor work and extractions at 50% co-insurance. And then you have class three, which is more of the major work, going to dentures and crowns, 50% co-insurance as well. So when you're doing this, looking up providers, you can go to our provider guide or anything like that, and you put in, let's say, vision or dental, it will take you to another site, which is going to be through Centene, where you can look up in-network providers. Off exchange product offerings. So we have new off exchange plans for 2025 called Ambetter Health Solutions. So I want to let this is a way for those who do not qualify for subsidies. You get the same benefit as on exchange. We have a large nationwide network. Okay, if you members are enrolled in this plan, they can cross state lines. They can cross state lines, okay, except California and New York. As I have mentioned, those states, or California is through HealthNet, which is a different entity through Ambetter, so they can't use across the state lines through those states. For off exchange as well, you can enroll through our Ambetter platform. You can also enroll through Health Sherpa. So our stuff is powered through Health Sherpa anyway, so you can use your personal account, or if you want to use your Ambetter account and go through Ambetter, that's fine too. Our Ambetter Health Solutions is going to be offering these following states: Georgia, Indiana, Ohio, Missouri, Mississippi, and South Carolina. I do want to let you all know too that a lot of agents out there that use ICRA, that do ICRA. So this benefit or this plans here, I would say, is not just for ICRA. Anybody can get on Ambetter Health Solutions. Keep that in mind. But we are tracking a lot of members or agents that was doing ICRA and putting members on into Ambetter Health Solutions. But yes, keep in mind that anybody can get on this Ambetter Health Solutions. So off exchange product offerings, this is the portfolio for Ambetter Health Solutions. You have the bronze, silver, gold. The bronze is broken down into the Ambetter Health Solutions bronze 1,800, 5,000, 7,000, and then you have the HSA 6,400 for the bronze. For the silver, You have the Ambetter Health Solutions Silver, 1350, 3000, 4500. You have the HSA 4000. You have a copay HSA 4000 and a 5000 under silver. For the gold and better health solution, you have the 1500, 2500, 3000, and the 3500 under the gold. All right, so this is the and better health solutions bronze 1800 plan copays. This specific plan here has an $1,800 deductible, $1,900 max out of pocket, 50% co-insurance, $120 specialist visit, and then it has a lab of 50% after the deductible is met. Does have an urgent care of $100 on this plan. All right, we have the silver 1350. This has a specialist visit and lab reduced costs, share after deductible. It has a deductible of 1350, a max out of pocket of 8600. It has PCP visit of $30. After deductible is met, specialist visit $60 and lab at $20. And it has urgent care at $60 on this plan. All right, we have the Gold 1500 plan copay. This has a $1,500 deductible, 6,000 max out of pocket, 20% co-insurance. There's a 20% after deductible is met for the lab. Then this plan has a $20 urgent care. All right, so we are transitioning on to Kentucky. What's going on in Kentucky? All right, so same as all of our plans, right? Core, we're going to Premier Network. We have the health app that launched in July. We the renewal letters we talked about, and Kentucky is now offering off exchange plans in all of our states. All right,
And
so it looks like
hey,
there's
just to note,
yep,
just to note, Ambetter in Kentucky is called WellCare of Kentucky, and I think those of you who sell in Kentucky know that. But I just wanted to point it out in case somebody gets a client that doesn't typically sell in Kentucky. You'll see it as WellCare of Kentucky, not Ambetter. Carry on, Shondell.
yep. Good note there. Keep in mind the state health plan. What's the name of our state health plans? Like WellCare, like Brad said, WellCare of Kentucky. Then Ohio, you saw Buckeye. So that's the name of our health plans. Kentucky, there looks like there's no expansion there, so everything is pretty much the same and consistent in those counties that we're in currently. So some of the network highlights, again, this is just partial provider list, just a list of some of the providers that we have in network going to 2025. If you have any questions around this network, you need a network list, anything, just, if you can follow up with me, your account executive, I'll be happy to assist you with that. So the portfolio, we have the three portfolio. We have the bronze. We have the choice bronze HSA and the everyday bronze. For the silver, we have the clear, complete, and focus silver. And for the gold, we have the complete and everyday gold. So this is the everyday bronze. Everyday bronze have a $0 virtual care, low copays for those preferred generic prescriptions. It's 8450 deductible, 9200 for the max out of pocket. Does have a 50% co-insurance, $50 for the lab. And then there's a 45% after deductible is met for the preferred RX. And then there's a $50 for urgent care on this plan. All right, the Focus Silver. This is a $0 deductible. And then this has lower copay starting at the 87% actuary value. It does have a $0 for PCP visits and $0 lab under the at the 94% actuary value. So starting at a base 6,300, going as low as $0, going as low as 1,350 for the max out of pocket. There's $0 across the board for virtual care. And then you have lab going as low as $0. And then depending on what the member fall, on the actuary value income level, it can go as low as $10. Focus Silver. All right, this is the everyday gold. This have a $750 deductible. There's a 7,000 max out of pocket, 35% co-insurance, 35, 55, and 35 respectively for copay. Then this plan has a $35 urgent care. All right, we are now transitioning on to Indiana. So what's going on in Indiana? All right, so we're not going to cover all that. It's the same network, the launch. The renewal letters, new office change that's offered, and better health solutions, right? And then Indiana, this is something to know. Indiana, and as I said, the state health plan, right? It used to be called MHS branding, managed health system branding. It used to be called MHS. So now it's going to be we're going to use Ambetter Health national brand. So our state health plan is going to be Ambetter Health national brand. Okay, existing members on that core network being enrolled in 2025 network plan. Just make sure they make their binding payment no later than December 31st. Statewide, we're statewide again, not going anywhere. Some provider highlights for Indiana, just a partial list, just to show in some pockets of the state and areas where we have our network. All right, here is the portfolio, HMO portfolio for Premier for Indiana. Keep in mind, this is the best, a great seller. Members can cross state lines. So, choice bronze, HSA, everyday, and standard expanded bronze under the bronze. You have silver, which is the clear focus and the standard. And then for gold, we have complete, elite, and standard gold. All right, this is the standard expanded bronze. This has a 7,500 deductible. There is a max out of pocket of 9,200. There is a 50% co-insurance on this plan. Lab 50% at the deductible, and the preferred RX $50 at the deductible, and then it has urgent care, which is $75 copay on this plan. All right, everyday bronze. This has an 8450 deductible, 9200 max out of pocket, 50% co-insurance. You have your lab at $50. Preferred RX, there's a 45% after deductible. And then urgent care is $50 on everyday bronze. Okay, Focus Silver. This has a $0 deductible, going as low under the 94% actuary value. This starts at a base of 6,300. There's a max out of pocket under the base at 8,000, goes as low as 1,350. Virtual care, $0 across the board, and urgent care going as low as $10. Okay. Oh, all right. 1 second. Hey, Brad.
Yes, sir.
Okay. Let me see.
Uh,
1 second, Brad.
yep. Everybody, please hang on a second. Maybe a wrong button got touched. So,
Okay, I'm good. Okay? Can you see
here
my
it
screen?
comes. Yeah, it comes back.
Okay.
You're good. Carry on.
Okay. Just so sorry about that. Standard silver. Okay, where I was at. This standard silver has a $0 deductible. There's a $0 PCP visit. This start at a base at 5,000, goes as low as $0. It does goes as low as 2,000 for the max out of pocket. Core insurance as low as 25%. You can see the lab starting at 40% at deductible. So good, paying attention to those, I think, on the plans are good. I know some people don't know AD, but just keep in mind members have to hit their deductible before that kicks in. So when they have the lab, the RX, all that stuff, that does make a big difference. So, but yeah, this is the standard silver. Standard gold. So standard gold, this has a 1,500 deductible, max out of pocket 7,800. There's a 25% co-insurance, $30 copay for both the virtual and PCP visits. For this plan, there's a 25% after deductible, and then has an urgent care that is $45. Complete Gold. This specific plan has a lower cost premium. It does feature the copays for generic and urgent care. So starting at $1,450, $7,500 for max out of pocket, 20% co-insurance. There's lab at $15, as well as the generic RX copay. And then this plan has $35 for urgent care. All right, so this is our portfolio for the PPO and EPO. Keep in mind with this, members can cross state lines. So this is broken down. You got the bronze, silver, and gold. The bronze is 1,800, 5,000, 7,000, and bronze HSA 6,400. And
And
then you have the
Shondell,
silver.
just to clarify, this
Yep.
is only in Indiana. This
Yeah,
PPO,
yes, that's correct. Yep.
Ohio and Kentucky still HMO gang. Just wanted to make sure everybody was paying attention.
Yep. This
So,
is Indiana. He broke up a little bit, Brad.
yep, go ahead.
You
Go
hear me?
ahead. Yeah, I just wanted
Oh,
to
okay, okay,
just
okay.
point it out.
But
You're
yeah, yeah,
good.
yeah. We're only talking about Indiana. So what we was broken down, but this is also Ohio and Kentucky. So I'm just talking about Indiana right now. But keep in mind that this portfolio is also in those other states as well.
Right. Bronze, silver, gold is obviously all the metal plans are there,
Yeah,
but it's just
yeah.
that EPO and PPO. I didn't want anybody to make an assumption.
Yeah, absolutely, absolutely.
Yeah.
So yeah, don't let the EPO throw you off. Even our HMOs, right? Because with all of our plans, members can cross state lines. So it really doesn't matter as long as that provider is in network. So that's like the best seller that you can give to members.
Yep.
So the Ambetter Health Solutions Bronze 7,000, which has a lower prescription cost after deductible. Okay, 8,500 max out of pocket, 50% co-insurance. We have lab 50% after deductible. Now it does have preferred and a generic. Looks like there's 20% after deductible is met for both, as well as the preferred RX. And then urgent care on this plan is $55. All right. This is the silver 5,000. 5,000 for the deductible. Has 7,750 for max out of pocket. Co-insurance 25%. The specialist visits at $80. $3 after deductible is met respectfully for the preferred and generic. There is a 30% after deductible for preferred RX. And then this plan has $40 for the urgent care. All right, we have the gold 3,000. 3,000 for the deductible, 5,000 max out of pocket. Has a 20% co-insurance on this plan. You have a 20% after deductible for a lab, and then 50% for preferred RX after deductible. This gold 3,000 has $50 for urgent care. All right. On to the broker portal. So, if you never have taken time to log in your portal, just go to this URL there, broker.ambetterhealth.com. If you need assistance, just give us a call there. And for those existing agents, you know this, right? So, it's always good to cross-reference your book of business. I know some agents out there use Health Sherpa or another platform. But log in. Keep note that there is some great information here. You can go to resources tab, and if you haven't took a chance to do that, you're going to find some great training and marketing materials up in there. When you log in, some of you all know this already. Keep in mind that once a policy is not active until that binder payment is received. Very important. That's how you start getting your commissions as well. But you can make payments from your portal if you need to. Quick pay. Just need a couple information there, and then make sure you monitor your payments closely. Ways your member can make a payment. So different ways they can make a payment. They can call it in. They can mail it. They can do MoneyGram. They can also update it. They auto pay through their member portal or the Ambetter launch app that we launched. And I'll let you know about that later. And then they can enroll in paperless or they can download their invoices all from their portal. So training materials, this is what you'll find in your broker portal. So if you have some time, you go to
Shondell.
resource. Yep.
Let me just go back a second. Go back to that
Yep.
last slide, please. So
Absolutely.
everyone, I just really wanted to point out because we've gotten a couple of clients hung up in this. When you do your binder payment, right, at the time of enrollment, it is not automatically setting up auto pay. So you have to go back in during that first month of enrollment and then set up auto enrollment for all of the succeeding months. So just by putting in the banking information for the binder payment does not automatically set up auto pay. So just wanted to point that out so
Good
nobody
note.
gets a frantic call from their client that money
Good
hasn't
note.
been deducted, right? So, all right,
Yeah.
carry on, Shondell. Didn't that was
Yep.
just an
No,
important note.
thank you. That's a good note
Yeah,
Brad made. Yes, thank you. Excuse me. So yeah, training materials. So a lot of great information you'll find in your portal. So you'll find a lot of great stuff around a network. You'll find great stuff around benefit programs, uh, brochures, like some flyers. You'll have to print that out though on your end, but you will find some stuff around our plans and off exchange. You also find some other information around, CMS, stuff that went out about CMS, anything around our enrollment platform that you may need help with, renewal letters, and then marketing guides. So anything around social media, if you're looking to promote or do anything around selling, around your business, we do have some information in there for you, and they are all state specific for you. So going into provider guide, you all may know this too, but that's the link guide.ambetterhealth.com. That's where you go to look up in-network providers on the Ambetter site if need be. You don't have an account, you get the same results as is, but just make sure you save that URL. Network changes. So as I mentioned, bronze, silver, gold core is now Premier Network. So you're going to see that when you're looking up in network providers as well as in network for our new off exchange plans. Okay. Keep in mind too, like states like Georgia and Florida, these guys have a different network. They do. Select, value, as you know, Ohio and Indiana, they don't have that. So it's just strictly Premier for you guys. But when you get into, if you're licensed or appointed, I want to say, in Georgia and Florida, and you have a member that's maybe on a select plan, keep in mind that the plan, that network is a little bit slim compared to Premier Network. So putting the member on Premier is the best way. That's all I would say. Premier Network is the best. That way members can cross state lines anywhere. I'm in Illinois, I'm in Ohio, I go to Florida, no problem. So also too, for the Premier, you'll see at the bottom right, these are only offering certain states too. So that was Georgia, Indiana, Missouri, Mississippi, Ohio, and South Carolina only. All right, formulary. Let you all know as a refresher, where can I find the formulary? Just make sure to go to ambetterhealth.com. Make sure you click on drug coverage. Very important that you make sure you select the state too first. And then it's quite a big file, so you'll want to hit Control F, and then you'll go ahead and input the medication there. If it doesn't come up, most times it's not covered. You will have to go through our member services team if you need to get, as more so an exception, I want to say. But you may find some generic drug closer to the drug that you're looking for that may be on our formulary. All right, my health page. This is like the great biggest benefit that we have is my health page because members can earn up to $500. So this is just a year to date. Nearly 500,000 members activated my health page. I was one of those people when I first started and got my $500. So it was free money, just doing a little bit different tasks. Collectively, we earned over $52 million in rewards members have. And those who activate, like myself, are likely to renew their coverage with Ambetter. Well, hey, why is that? With my health page, you earn points. You earn points doing different fun, different easy activities. This is a way for members out there for their health, and then they use these points to shop online reward store. They get a nice raspberry color like that with their name on it, and then they can use this to pay all kinds of bills. Well, hey, what kind of bills? Healthcare related costs. You got premium, you got doctor copays, deductible, and co-insurance. We can pay for that. Is that all? No. Monthly bills. We all got bills, right? Utilities, transportation, education, rent, whatever. We can use My Help Pays for it all. Keep in mind too that there is a flyer for My Help Pays like this, which is in your broker portal right now. It's in your broker portal. So this is a big seller, letting members know, hey, you just got to do different activities, surveys, or stuff, and you get these points that will convert to dollars for you, and you can use it for a lot of things. And once you tell them what they can use it for, they'll be surprised, and they can reduce their premium by $41. So if they're certain area we're not looking to price advantage in, hey, this is where they can knock that off. Member discounts. So we do have a member discounts for gym memberships. Those that like to go to the gym trying to lose weight. Okay. Members just need to go to infinity.com. Oh, I think that wasn't on there, but they can just need to go to infinity.com, and then there is a registration code that they put in called member perks. So if you need any assistance with this, you need to follow up, just feel free. We can help you out. But I just want to let you all know that this is that for the member. Just need to make it count. Member support. So just some different programs, initiatives that we have for your member that you can share with them. We have a Start Smart for your baby. There's a 24/7 nurse advice line. We have CRC Center. We have care management and health management programs. All right, here is the app. Oh man, the app. This came out in July. So with this, let's think about this, right? We understand members are not so tech savvy or computer and everything, right? But we know everybody is on the phone. Everybody is in their phone. So everything the member wants to do or save you the headache or want you to do, they can do this all through their phone. Download the app. They can check out their, ID cards, anything around their plan, claim history, enrolling in auto pay. They can do all that from the app. Moving forward, keep in mind this is only available for iPhone and Android, but it is in the Apple Store and Google Play to let your members know, hey, download this app right now. Okay. Even thing around PCP, I'll let you all know that right now is on the wish list, but we are hoping in the future that you all as brokers can go in and change the PCP for the member. So that's on the wish list for the future. But right now, members can just download the app and they can select the PCP or change it. Save the headache from customer services, right? Or calling in. All right, here is the contact information. So on the left side, broker sales support. That's what they're there for around, member issues, inquiries, anything around commissions, anything around anything around the systems. Find a provider, call them at 855-700-7985 option 2, and that's their email as well. And then you have broker sales, which is I'm on that side. We help a lot with the education about the commissions and bonus programs, a lot of training, for our newer agents and existing agents. And then, we help out with anything around contracting, and we do a bit of the same stuff as broker sales support do. But if you can't reach out to them, reach out to us. Same thing, option 3. I did leave my information there, Shondell Coleman. My email, shondell.d.coleman@centene.com. And then you have my office number, 312-619-3087. This is there for you in case you need to reach out to me, any questions, you need to talk to me about different markets, whatever you need. I'm here for you all. Okay. And
That's
then,
awesome, Shondell. Oh,
yeah, yeah,
carry
yeah.
on. Sorry. I thought that was the
No,
last slide.
I'm coming to a wrap. So this is just the website for the state health plan, Buckeye, in case you all need to go to the website, and then the member services number. So, hey, I want to thank you all for being here this Friday early morning, and I hope you go into the weekend with a lot of excitement. So, but
Yeah,
yeah, thanks,
great.
Brad. I'm gonna,
Yeah,
yep,
no, thanks, Shondell. A lot of great information. Um, and there are a couple questions coming in. So,
yep,
really a good one here with diabetes being so important. The question is, where can we find information on what specific insulin pumps would be covered? I don't know. That's not something that's typically on the formulary because it's considered DME, but where could they
yeah.
find that?
Well, yeah, you won't be able. I mean, if I like insulin's cover, I mean, you'll have to. At the end of the day, you'll have to have medications on hand as far as okay, I got this insulin. I need to see how it's covered. Go on our formulary. You got to go on
Right.
our formulary to see if it's covered. And like I said, if it's not covered, is not covered unless you want to try
Yeah.
to get exception for it.
Yeah.
But please download the formulary though. You know,
Yeah.
so you can see if any insulins or any medications around that is covered for you.
Right. And so
Yes, that.
that's the actual insulin, but there's a
Yeah.
pump that pumps it in. Is that a question that broker support can answer, Shondell, or
Yeah,
you
it'll
might
come
have
down to
access to
customer.
dig in
Yeah, it come to actually customer services. They would have to
customer
confirm
service?
that. Yeah, we wouldn't know that we don't have access to certain systems on our end in sales or broker support. So you will have to go through customer services. Yeah,
Okay. So member
yeah,
services is going to be able to answer that question
yeah,
better. So sorry, can't give you a
absolutely.
hard answer on that one.
Yeah,
Let's see. Um, that was the only question so far. Others, yes, everybody. In case you didn't see it, I did reply. We are this slide deck is really massive. Shondell can't even send it to us, but we're gonna work on it on Monday to give kind of an abridged version of some of the key slides on
yep.
plans and some of the important benefits. So hopefully, when we send out the recording, it's probably going to be Monday, Tuesday next week. Shondell and I will, and Jeff will work on, uh, putting together key slides, which you'll also be able to download when you see that email as the follow up to the Ambetter presentation. So be on the lookout for that. We will get you those key slides. And
Oh, oh, and the state webinars too. If you haven't
oh,
signed up for any
right.
state webinars, yeah,
Yeah,
those
I
going
think
on
I
too.
think actually we shared that already from
Good.
the previous was either in an email this week, and if you're still on listening in from the road, I know we sent it out. I just can't remember if it was the follow up to the previous Ambetter presentation, or if it was in a separate email earlier this week. But I know that we did it. So if you
Awesome.
want to join any of those state specific, or even Ohio again, or Kentucky or Indiana, which we covered here, you can. So yeah, if you can't find it, let Jeff or I know, and we can dig it out and email it to you. So
Hmm.
that's it.
Hmm.
I'm seeing no other questions, Shondell. So
Oh,
a
all
lot
right.
a lot of the same people that were on previously. They really wanted to see the plan
Yeah.
information and get reminded about some of the other great information. I think for some of the newer brokers, um, one thing that I wanted to point out, but I didn't want to interrupt. So where you see a copay for like PCP and specialist, those are usually before deductible, right? Because those are some of the accesses to care that
Yeah.
CMS wants members to have. So
Right.
that's don't be afraid of those deductibles. But and I think when you do plan details in Health Sherpa, it will say before deductible, so it makes it a little bit clearer that there's copays on some services before deductible.
Yeah. Yep. Yep.
So,
Hmm.
gosh forbid that somebody has to spend $8,000 and then pay a $25 copay to see a
Right.
specialist. So,
Yeah.
um, yeah, so I think I'm not seeing any other questions coming in, and I'm starting to see people drop off. So I think we're
Okay.
going to go ahead and close and wish everybody a great weekend. Thank you all for joining. Shondell, thanks for doing this again. We really
Absolutely. Yeah.
appreciate you. I mean, Better is such an important carrier for us. They're actually our number one carrier, and they are obviously for many of you. So thank you all for joining. Have a wonderful weekend. I thought it was going to be sunny all weekend here in Northeast Ohio, but they mentioned maybe some raindrops tomorrow afternoon and Sunday,
Oh.
unfortunately. So
Uh-oh.
just when we get a couple of days off, then they talk about
Right.
rain. But when I'm sitting here looking out at the sunshine, I can't do
Oh.
anything about it until the end of the
Yeah.
day. So anyway, everybody, Have a great weekend. Thank you for joining. And that is all. Take care. Shondell, thanks again. We'll
Yep.
talk
Have
to
a
you
good
on
one.
Monday. All right. You got
Sounds
it.
good. Bye
Thanks.
bye.
Bye, everybody. Take care.